So, if you've ever had your wisdom teeth out, or maybe you've had a really painful injury, there's a good chance you've been prescribed a combination of hydrocodone and acetaminophen. You might know it by brand names like Vicodin or Norco. And look, it's one of the most common painkillers out there for a really good reason. It works. It's incredibly effective. But that power comes with some serious and often hidden risks that we absolutely need to talk about.
So, here's what we're going to cover. We'll start with how this powerful duo actually works its magic. Then, we'll get into the overlooked danger, the one hiding in plain sight. We'll explore the risky chemical cocktails that you have to avoid, and then we'll get into the very real world of dependence and withdrawal. And we'll wrap it all up with your guide to safe use.
All right, first things first, let's dig into what makes this medication so darn effective. You see, it's not actually one drug, it's a team of two, working together to knock out pain.
The best way to think about it is like a two-pronged attack on pain. On one hand, you've got hydrocodone. It's an opioid, and it works up in your brain, basically changing how you feel pain. At the very same time, you've got acetaminophen working down at the actual site of the injury, blocking the chemical signals that are screaming pain to your brain. It's this one-two punch that makes it so much more powerful than taking either drug by itself.
Now, to really get how the hydrocodone part works, you need to know this term, opioid agonist. Hydrocodone belongs to this class of drugs. What that means is it binds to and flips on these special switches, opioid receptors, in your brain. Turning on those switches is what gives you that deep, powerful pain relief. But it's also that exact same mechanism that opens the door to potential addiction.
So what's it actually for? Well, the FDA has given it the green light for managing moderate to severe pain. We're talking about the kind of pain you get after surgery, a really bad injury, or even from cancer. And here's a little bonus fact for you. It's also a surprisingly effective cough suppressant. Okay, now we're going to shift gears a bit. We're going to focus on the part of this medication that honestly most of us probably think is totally harmless, the acetaminophen. But it has a very real and often overlooked danger. I want you to burn this number into your brain. 4,000 milligrams. 4,000. That is the absolute maximum daily dose of acetaminophen that a healthy adult should take. Going over that amount, even if you don't mean to, can cause severe and sometimes even fatal liver damage. And listen, this isn't just some friendly advice. This is a direct warning from the FDA. Their data makes it crystal clear. The vast majority of cases of acute liver failure from this drug happen when people cross that 4,000 milligram line. And a lot of the time, they don't even know they're doing it. So how in the world do people accidentally overdose? It's because acetaminophen is hiding everywhere. It's in tons of over-the-counter cold and flu medicines, and it's even in other prescription painkillers. This is why you have to become a detective and check every label for the word acetaminophen or its common abbreviation, APAP. It's the only way to make sure you're not accidentally doubling or even tripling your dose. Okay, now we're getting to the next level of risk. This medication isn't just risky on its own. When you mix it with other common things, it can become incredibly dangerous. It creates a truly risky and potentially deadly chemical cocktail. The danger here is so profound that the FDA has slapped its strongest possible caution on it, the black box warning. This is reserved for drugs with major life-threatening risks. When you see this, it's a giant red flag for both you and your doctor to pay extremely close attention. I'm going to read this directly from that FDA warning because every single word matters. Concomitant use of opioids with central nervous system depressants, including alcohol, may result in coma and death. The message could not be any clearer. Mixing these things can kill you. Let's break this down a little more because some of these are really surprising. Obviously, mixing with CNS depressants like Xanax or just having a drink of alcohol can literally make you stop breathing. But look at that second line. Even an over-the-counter allergy pill like Benadryl can be deadly. Why? Because it can block the way your body processes the hydrocodone, causing it to build up to toxic levels, which can lead to a fatal overdose. The same thing can happen with certain common antibiotics. It's serious stuff. So far, we've been talking about the immediate dangers. But what happens if you're taking this medication for a while? Well, your body can develop what's called a physical dependence. Now, this is different from addiction, but believe me, it is still incredibly serious. So if you're physically dependent and you suddenly stop taking the medicine, you are going to experience withdrawal. And this timeline shows you pretty much how it goes down.
Symptoms can kick in just 6 hours after your last dose. They usually hit their absolute peak in the first few days, and while the worst of it is usually over in about a week, some of those symptoms can hang on for months.
And we are not talking about mild discomfort here. People often describe it as the worst flu of their entire life, times 10. It is intensely physical. We're talking about severe muscle and bone pain, vomiting, crazy anxiety, the whole works. This is exactly why it is so critical to have a doctor's help when you're ready to stop taking it.
So here is the bottom line, and this is another direct warning based on FDA guidance. Never, and I mean never, stop this medication cold turkey if you've been on it for a while. The consequences can be devastating, not just severe withdrawal and pain, but in some tragic cases, it has even led to suicide. You have to talk to your doctor about a safe way to taper off.
Okay, we have covered a lot of serious risks, so now let's pivot to the most important part of this whole conversation, how to actually use this powerful tool for pain relief safely and effectively. This is all about empowering yourself. Let's start with the acetaminophen. Following these 5 simple steps is your best defense to protect your liver. Number 1, read the labels, always. 2, know what's in your other meds. 3, avoid doubling up. Don't take 2 things with acetaminophen at the same time. 4, if you're ever not sure, just ask your doctor or pharmacist. And 5, always respect that 4,000 milligram daily limit.
It is also so important to know the warning signs that something might be wrong. So when is it time to pick up the phone and call your doctor, or maybe even get emergency help?
If your pain isn't getting better, that's a sign. If you feel incredibly tired, confused, or if you have any trouble breathing, those are huge red flags for a potential overdose. Of course, any signs of an allergic reaction like a rash or swelling, that's an immediate call. And here's an interesting one from the research. Report any changes in your hearing, which can be a rare but serious side effect. And one last really practical tip, what do you do with leftover pills? Please, do not just leave them sitting in the medicine cabinet. That's how accidents happen with kids, pets, or other people in the house. The safest way to get rid of them is to mix them with something gross, like used coffee grounds or cat litter, seal it up in a container, and then toss it in the regular trash. And that really brings us to the central question, the big one that every single patient and doctor has to think about with this medication. It offers incredible, necessary relief for so many people, but that relief absolutely comes with significant, undeniable risks.
Ultimately, the power to use this medication safely is in your hands. If there's one thing you take away from all of this, let it be this. You have to be an active, informed participant in your own healthcare. Understand what you're taking, know the risks, and never, ever be afraid to ask your doctor questions. Your health truly depends on it.